I repeat, neglect led to his death. The report has found that he was not given food for 100 hours before his death. Now, during his ordeal, he managed to reach out to the Health Minister, Dr. Xoli Mngambi, via Twitter about his treatment at the Tembisa Hospital. The Health Ombudsman, Professor Lekopane Mogaladi, has since recommended that 19 staff members, including nurses, doctors, face disciplinary action. Joining us now is Dr. Lekopane Mogaladi, the CEO of Tembisa Hospital, and he joins us now. Doctor, thank you very much for your time. Can I just first get your reaction to what the Health Ombudsman has said, and that this death was definitely avoidable, but because of negligence at the hospital, he died?
Well, thank you, thank you, Xoli, for having me. As a principal, I've actually decided we have decided as a hospital not to actually go into the material detail of the report vis-a-vis whether what the Health Ombudsman is saying with regard to the clinical management is true or false. Our principle is that we want to accord the family the chance of mourning and actually reflecting on their loved one. We are actually taking this matter on appeal. We'll actually going up to all the level, up to exhausting all the internal processes exhausted by the Act. So discussing minute details, according to us, will be an ethical violation of the patient's rights, will be violating the patient's rights.
My understanding, Dr. Mogaladi, is that the Department of Health in Gauteng has welcomed these findings from the Health Ombudsman. Now you are saying that you are going to challenge this report and its findings. Does that not go against the very welcoming by the Health Department, whom I would assume you answer to? Help us understand that.
Well, I wouldn't actually answer on behalf of the Health Department. I will actually answer as the affected party, the party through which the incident happened, and the party through which the staff members that actually have been named are actually going to be facing disciplinary hearing, the party through which all staff members are actually accorded the right to exhaust all processes as provided by the Labor Relations Act. The Health Department can actually accept it on principle. We have actually noted it, and we have actually identified factual and procedural errors in that report, and that's why we want to take it on review, Xoli.
So you completely disagree with its findings, and that is the reason you are taking it on review?
Yes, you know, there are so many material errors in that report. There are so many material errors in that report whereby some of them actually make a mockery of the impartiality of the office. So we actually feel that a better dispensation will be able to come to a different solution. For an example, we provided a list of patients that were in the same area as the deceased. But the ombudsman completely rejected it and he said we cannot actually provide it. But he has got the audacity to say he actually searched 5 patients and he actually telephoned them, he could not find them. So out of that, he was actually able to make a finding that has got a material impact on the welfare and livelihood of actually people that work so hard day and night to actually service the people of Tembisa.
Dr. Mogaladi, you will know this morning, if you're not aware, let me tell you, that the Lethole family is going to hold a media briefing, and they will be joined by 6 other families who say they have lost loved ones at the hands of your staff at Tembisa Hospital. Are you saying that all those families that are going to come with their stories today, they are simply lying to the public?
I may not talk about the families that I do not know. And I believe that every person in the country who has been aggrieved through the hospital have got a procedural way of actually following up, and due process will be followed. And it will actually be kind of unreasonable or foolish of me to dismiss or to actually try to dissuade people for actually challenging the hospital. I've said it on record many times that we are a hospital that actually permits transparency. We're a hospital that allows to be interrogated on our processes. I myself, and I'm at a strategic position as the CEO, I've deployed men and women who are actually instituting healthcare service on the ground. And those men and women in pursuit of their service may err, rightfully or wrongfully so. And it is the honest and responsibility of the patient, as actually enshrined in the Constitution, for them to actually lay a complaint, for it to be investigated, solution found, and they be remedied accordingly.
Final question to you, Dr. Mogaladi. You will know that the Health Ombudsman has also recommended that over and above the 19 staff members, including nurses, doctors, who must face disciplinary inquiry, you yourself and the accounting officer also ought to face that disciplinary inquiry. Is this your rejection of this report? Is it an exercise that is aimed at saving your own skin and reputation?
Thanks, Xoli, for the question. I've been brought in the culture of collective responsibility. I'm an accounting officer that accounts for the happenings within the hospital. Even if I may have been exonerated, I would actually still pursue with this thing, because a reflection on the functioning of the hospital is a reflection on me as the accounting officer. Suffice to say, the report that says I must be disciplined, if you listen to the ombudsman yesterday, when the question was asked about the CEO, he said the CEO does not actually see patients. The CEO does not see patients. I do not see patients. I deploy people who go there and actually see patients. Yeah. So I did not do this to actually save my own skin. I'm doing this in line with the Act to exhaust all legal remedies that are available within the rights as prescribed in the Act, the Health Act that was enacted.
Dr. Mogaladi, I thank you for your time. I'm simply astounded, but your message perhaps to this family that lost a loved one in the care of your hospital. What's your heartfelt message to them?
As I always said, and that's why we deliberately did not want to actually communicate on this matter. A loss of a loved one is very, very painful. Especially I feel for the parents. I feel for the mother who actually had dreams for their child. And I say, no amount of words can actually bring your loved one back. And as an accounting officer, as a human being, I actually share your pain. And that's why I deliberately choose never to go back on this thing in the public space. Because to me, it's like I'm researching your pain over and over again. And that's not something that I want to be part of. May God comfort you.
Dr. Lekopane Mogaladi, CEO of the Tembisa Hospital. Thank you very much for your time, sir.
Welcome.
Thank you.